Susan Osborne is always on the move. Over the years, she's provided full-time care to 5 different family members, and she's never earned a penny doing it. She still looks after her disabled daughter, brother-in-law and husband John.
I mean, with John at the moment, it's everything, because he can't move, so I'm cooking, cleaning. He can hardly move out the chair. I'm having to help him with his walking. I try and help him in the bath, but it's a nightmare at the moment. It's very, very stressful, and sometimes I'm so tired, you know, and then I get irritable, and then I get snappy. And I don't mean to be, you know, but sometimes it does get too much, you know, and it's really, really hard for carers.
What makes it even harder is the finances. Susan had to give up her job to care for her family, and the carer's allowance she gets comes with caveats.
So obviously £83 a week, it's not a lot of money. Now, it's taxable, so it's not a benefit. So the problem with that is that because John's on benefits, they take that off his benefits. They take half of it. So although they give me the 83, they take £40 off him. The politicians don't understand how we survive, really, because they don't have to.
Every carer's story is unique, but there are many more stories to tell. New research shows the number of unpaid carers working more than 35 hours a week has skyrocketed to 1.9 million people, a rise of 70% in 2 decades. And there's a crisis of supply and demand when it comes to getting help. While requests for adult social care have risen 15%, capacity has only gone up by 2.5%, leaving the system at breaking point.
We're already seeing some of the cracks in the system. We know that more and more people are having to be unpaid carers, left with no choice because the system is too unaffordable. And we also see the impact on local authorities and local councils. So for many local councils, the majority of their budget goes to paying for social care, adult social care and children's social care. And that means less money for bus services, for libraries, and a declining trust in our local government. And so we are already seeing the impacts, and so the solutions are really urgent. We need to find a way to pay for care which is affordable both to individuals and to the taxpayer. We need to build support for the system in the long term because more of us are going to need it, and that work has to start now.
The government is now looking into how it could eventually implement a national care service, similar to the NHS. But researchers warn against trying to make care free for everyone, instead recommending it be made affordable for everyone.
There are very few or no comparable countries that have completely free social care at the point of use. And what we have are some really pragmatic models, you know, things like free personal care in Scotland, insurance-based models where you pay in a little bit and you get out, such as in the Netherlands and Japan. We've got means tests like in Australia where you pay what you can afford. So there are all these experiments going on abroad that we can learn from and start putting into motion.
The Department for Health and Social Care told us, "We value the immense contribution of all unpaid carers. That's why we've delivered the biggest uplift to the carers allowance threshold since the 1970s, an increase of around £2,000 and a reviewing carers' leave." They added, "We inherited a social care system facing significant challenges, but we are turning it around." Back in Manchester, that's what Susan and John say they desperately want to see, so they don't have to worry about their future. Leisha McNally, ITV News.